welcome. Welcome to the Doctor Connect, where we are connecting through inspiring stories and providing education and information around wellness, health, cancer, and medical technology. I'm your host, Dr. Lyudmila Schaefer, medical oncologist specializing in gastrointestinal cancers. All information discussed on this platform does not substitute your medical care. Guests on this platform sharing own stories, experiences, and conclusion. And thank you so much for being with us today. Have you ever heard gut feeling? Well, it is so much familiar, and you will be surprised because today we have a very special guest, and we will discuss a lot about connection, communication between brain and gut. Stay tuned with us. We will be right back. Well, hello, Dr. Drossman. Welcome. Thank you so much for being with us today.
And thank you.
A pleasure.
Thank you so much for having me. It's a pleasure to be here.
Yes, our audience, and I'm so excited today because we are speaking about gut feeling, and we were just discussing who hasn't heard about gut feeling. We always talk about it, and we're not sure how is it related. And then I found out you actually wrote a book about gut feeling. So for purpose of our audience, I would like for you to tell us your full name, where you're located, and then we will start our conversation.
My name is Douglas Drossman, and I'm a gastroenterologist, also trained in psychiatry, and I'm in Chapel Hill in Durham, North Carolina, and I'm also been involved with a group called the Rome Foundation.
Excellent. Dr. Drossman, can you please tell our audience what's Rome Foundation?
Yes, the Rome Foundation is an organization I founded about 30 years ago that sets the standards for diagnosis and treatment of what we're now calling disorders of gut-brain interaction, which many of you know as functional GI disorders, irritable bowel, constipation, nausea, and vomiting, all the disorders that we see in GI where there are no structural findings. X-ray and endoscopy is negative, but that's 40% of GI practice, and it's the most common conditions seen in primary care practice.
Thank you. So for our audience, we would like to tell that gastrointestinal, it means it includes all from the esophagus down to small intestine, large intestine, stomach, pancreas. And for more information, it will be placed on my website. So please stay tuned and connect with us at thedoctorconnect.org. But we would like also explain that gut play a lot of role in motility, absorption, fluid secretion. It's about 9 liters of fluid on average that we secrete. So it's a lot of other connection and anything happen in our body related to gut. And obviously this year, for purpose of our audience, American Society of Clinical Oncology actually nominated for gastrointestinal cancers as was top priority because there's so many new discoveries, there's so many new approaches in treatment, diagnosis, and how we evaluate and treat. But obviously, everything starts from baseline, from normal gut, and then how our nutrition works. And then also when we develop any symptoms, how do we take this to healthcare professional? So with healthcare professional, communication needs to be very accurate. So and develop patient, physician, patient, and healthcare professional relationship. So with that, Dr. Drossman, please tell us a little bit of your backstory, or where would you like to start?
Let me start how I got into this. I really found gastroenterology fascinating, and in many ways because it covers so many different things. As you talked about, motility, secretion, sensitivity. feeling pain or nausea relates to the sensitivity of the nerves. And I was always interested in that, but I always felt that we have no real ways to understand that when patients come to us with symptoms, because as I said, so many of them have negative evaluations. The endoscopy is negative, and there they are in pain or having diarrhea. And I began to get interested in the brain-gut connection, what we call disorders of gut-brain interaction, because we're learning that the gut and the brain are what we call hardwired. No other organ is as closely connected to the brain as the GI tract. It has its own nervous system. We call that the enteric nervous system. And the enteric nervous system, which we call the little brain, is talking to the big brain. And that affects the way we experience things. If you're running a race and you sprain your ankle, you may not feel that pain till after the race, because the brain has the ability to send down signals to the body and block it. And when we talk about GI function, all the motility and all the secretion and all the pain sensations is regulated. But when that system is not working right, we have one of these disorders. We can have chronic abdominal pain, we can have irritable bowel, we can have diarrhea, and it's not just what the gut is doing, but how the brain is regulating it. And I think chronic pain is another good example where you don't see anything, but it has to do with the regulation, something we call the gate control theory, where the brain has the ability to modulate what's going on in the gut.
So with speaking of the brain, and for the purpose of this show, we won't go into all pathophysiology, but in your experience, if someone has any additional, let's say, comorbidities or mood disorders or anything that's going on, do you think that influence on our gut or not?
Absolutely. But before we get into people having a medical problem, the average person, when under stress, can be in an experiment where you can study their pain, and their pain threshold goes down. They feel more pain when they're under stress. And you can be hypnotized to have GI abnormalities or like pain, or you can be hypnotized for pain to go away or even to come on. So we are always influencing things. Now, if you have an additional problem like anxiety or depression, we know you're more likely to have butterflies in your stomach or diarrhea or problems like that.
So butterflies in the stomach are real, correct?
Butterflies in the stomach is the way the brain under stress may be influencing motility, making things go more faster, creating gas bubbles that might be called gut butterflies, and can also produce cramping. Because when the bowel stretches or moves faster, the bowel stretches and that produces pain. And if on top of that you have a lower pain threshold because the brain is causing that to happen, you may have a condition. We could call it irritable bowel or functional diarrhea or any of those conditions.
And in your opinion, what nutrition play a role? Right now, we discuss a lot, especially for the last, probably 5, 7, maybe 10 years. Overall, the nutrition changes, and a lot of things that we, see in a grocery store or maybe the way things produced, it might be changing, and we're not sure how exactly. Do you think nutrition play a role in this situation?
Well, of course, nutrition can play a role in the gut. It can play a role if you have a gut problem where you have to alter your diet. But generally, an adequately balanced diet with good nutrition, good balance of carbohydrate, protein, and fats would lead to the stomach and GI tract functioning more normally. A high fat diet can affect motility, can produce diarrhea. And if you have a GI condition, such as irritable bowel syndrome, where your bowel is more sensitive to food going in, you eat a meal, and within minutes you get bloating and cramps and diarrhea. That could be because certain foods that you eat are metabolized by the bacteria in a way that cause gas, and that gas stretches the bowel and you get pain. So what we talk about is a low FODMAP diet, which a lot of people hear about, is eliminating. I won't go into the terms of what they all are, but it's complex sugars, things that are not digested well, but the bacteria chew it up and produce gas, and that stretches the bowel, and you get cramps and diarrhea. So if you reduce the FODMAP, you do better. That's a very popular method for treating irritable bowel syndrome.
Actually, Dr. Drossman, I would like for you even emphasize more, because FODMAP diet plays a huge role. And a lot of times, yeah, it's unfamiliar terminology, but I feel like maybe our audience can learn, because it's a really small polysaccharides. It's your sugars that's in a tiny, right? In a tiny small sugars.
Well, it's fermentable, meaning that the bacteria digest it. Oligosaccharides, which are carbohydrates, disaccharides, which is like fructose, because glucose can be absorbed quickly, but fructose doesn't get absorbed that well. So when it doesn't get absorbed in the body, it goes down the digestive tract, and the bacteria have a party when it reaches them, and they eat up these carbohydrates, and they produce gas, and gas produces the stretching and everything else. Monosaccharides, and also polyols. Now, what it translates into is wheat, gluten, these carbohydrates, sorbitol. If you're trying to diet and you eat dietary foods where sugar is substituted for sorbitol, that's another sugar alcohol that can be broken up and lead to this problem. Fructans and other types. So basically, it could be vegetables, what we call cruciferous vegetables like broccoli, asparagus. That can be very troublesome for people with a sensitive stomach, even if you don't have irritable bowel.
Yes, absolutely. And I personally saw patients that actually just by controlling with this diet, actually symptoms get better. And that brings us to a very important point about gut microbiome and microbiota. So this is exactly when we see the colonies of bacteria. And over a period of years, we did not really have a lot of studies about microbiome. And right now it's actually becoming one of the largest things that we are evaluating and conducting research. So for the gut microbiome and bacteria, we do have, for example, in the colon, for the purpose for the audience, we have left colon and we have a right colon. And also there are different bacteria sort of have a place of residency in one side of the colon versus another side of the colon, as well as that anything that we eat, as well as excessive or maybe less amount of probiotics, or if someone taking antibiotics, all of those things also change. So Dr. Drossman, can you tell us a little bit your opinion or about microbiome in gut?
That's become so popular these days, and there's a lot of science to follow that. The microbiome is a whole, what we call an ecosystem. It's like a whole other world in your body. We're talking about 100 trillion bacteria. And it's not only the bacteria, it's the viruses and parasites that reside in there. And one way to look at this is there are good bacteria and there are bad bacteria. Bad bacteria produce lactic acid, they produce toxins. Good bacteria protect the gut from what we call leaky gut. They protect the gut from these toxins getting into the body. So the balance between the good and the bacteria is very important. That's why when you have a disorder like, say, irritable bowel, where you have a oversensitive gut, it's because the imbalance is wrong. You have more bad bacteria, and that produces chemicals that disrupt the barrier, producing the leaky gut, and they drop down into the bowel, and they can make you feel more gaseous, more bloated, more pain sensitivity, and more diarrhea. And probiotics is an example of the good bacteria. So that contains chemicals of bacteria like bifidobacter, which is very popular, and it works to replace the bacteria. And so that's been mentioned a lot for digestive health. Sometimes the disease can get so bad, the symptoms, that you give them an antibiotic. We usually use what's called rifaximin, which is only works in the bowel, but it breaks up the bacteria and it gets rid of all the bacteria, and then it repopulates in a healthier state. So the microbiome plays a real role in gut. And the other interesting thing in the last year or two is that the microbiome can affect mental health. There's a probiotic called Bifido longum, which has been shown in humans that when you have irritable bowel problems and you treat them, the bowel gets better, but anxiety gets better because the bacteria are involved with the brain-gut connection, and it could send down up signals to the brain to be affecting it very positively as well, if it's the right group of bacteria.
Excellent point. And Dr. Drossman, I'm so glad that you brought up about, so many important points. We discuss about mental health and the gut. We discuss about microbiome. We discuss about nutrition. And this is so many different terminology, right now with the all new terminology, and it's growing every day for the community. It's just hard to pick up. And if I've never actually heard of it, it's really hard for me, for example, go to the doctor and address it. And when we are so knowledgeable and there are so many research and publications and new studies and clinical trials, then for the person, when the person shows up, let's say to the doctor, and now we discuss all this information, do you think it's easy for the public to understand? And how can we make that communication easier for our patients and community?
Well, first of all, you're right. The amount of knowledge is growing. And I think one of the greatest areas of knowledge that's really relatively new are these understanding these new disorders like functional pain, irritable bowel syndrome. And it's very difficult because patients are expecting that they're going to see something on X-ray or endoscopy, and they don't see anything. And sometimes the doctors can actually treat patients somewhat negatively. They could say, well, we don't find anything. There's nothing wrong. And the patient says, well, of course there's something wrong. Am I crazy? And the doctor says, well, maybe it's stress. And the patient says, I'm not under stress. So we have to understand how to communicate these disorders in terms of the regulation between the brain and the gut. Our group, the Rome Foundation, is training doctors around the world about these disorders. Patients can learn from the book called Gut Feeling because we go through all of these diagnoses, all 33 of them in adults and 17 in children. Children have these disorders too. And you learn that there are things you can do dietarily, lifestyle, and then the kinds of medications you can use to treat it. And your doctors have to be trained to do that. I would suggest that you have to get, if you're going to a specialist, go with a doctor in gastroenterology who has an interest in this area. We call them neurogastroenterologists, just like
neurogastroenterologist. Well, now his audience totally with us. Can you tell us what's neurogastroenterologist, please?
It's the understanding of these disorders that have negative structure, that the relation between brain and gut and the treatments. For example, patients who have a lot of abdominal pain, we use antidepressants, not because it's a psychiatric problem, but it controls the pain. You can use antidepressants for diabetic pain. There's even work in cancer pain, you can use it. So neurogastroenterologists are skilled to use those kind of medications working at the brain and those working at the enteric nervous system. Medicines like linaclotide, lubiprostone, allocetrone, they're working on the enteric nervous system, affecting gut and motility.
Excellent, thank you. And you just mentioned that you discussed about disorders that actually happen in children as well. So if it's a parent, if the parent listening us right now, what would you advise? At what age? Because children are children, and also teenagers are teenagers. And the other day, I actually had a guest on my show. We discussed about adolescence and how communicate at what age, when we should pay attention that in children.
Well, we should pay. These disorders are common in children going back to age 5 or 6. As soon as they're talking, they'll complain of belly pain when going to school, and the sensitive doctor, the good doctor, is going to address this as an understanding of how the body is working, not that it's psychiatric. It's so common for doctors to say it's all in your head, and that never works for patients, never works for children. It only works when you say your head can control it, but you have a GI problem where it's not controlling it properly, and we have to work on methods. And even hypnosis can be helpful, and what we call cognitive behavioral treatment, methods to give you better control. Because when patients have chronic GI symptoms, what happens? Over time, they get frustrated. I can't make this better. I better not go out on that date. I better not go to that restaurant. And their reluctance to do that creates anxiety and frustration. And that acts on the brain to make you more sensitive. So we have to reverse that. So reverse it medically on treatments of the bowel and on treatments of the brain's regulation as well.
And how can we educate physicians to pay close attention? And right now, really everybody is so busy, and patients coming in, and especially like for children, you said, a lot of times they think, oh, it's your grade, or it's your behavior, or you just don't want to study. But how can we educate physicians? What are tools our healthcare professionals should implement from your standpoint? And I understand that this is, we are discussing here and sharing personal experiences and conclusions, but I really would like to hear from you as an expert.
Well, first of all, you got to start with the doctor. And the Rome Foundation has now received tremendous amount of support to do workshops, webinars, and you can go to the romefoundation.org, which is our website, and see free videos and educational programs for patients and doctors. So you can go in. We have over 70 videos where I'm giving little mini lectures on these conditions, and we cover interviews with patients, and patients can talk about their stories and what made them better. So I think the Rome Foundation website is a wonderful thing you can do. The Gut Feelings book has links to those videos, and then we're training doctors to do this as well. The other thing is that patients have to learn to stand up to their doctor. If their doctor is belittling them, or the patient should say, I don't feel comfortable with you saying that. There's a technique.
Patients, I'm sorry interrupting you, but we hear this all the time. Well, I just did what my doctor told me to do.
Yeah. What we call talking about is patient-centered care. And the Institute of Medicine in 2001 said that the patient makes the decision. The doctor provides the options. Now, obviously, if someone's coming in with a gallbladder attack, there doesn't need to be much discussion. The doctor says what needs to be done. But if you have chronic symptoms of nausea, the doctor should provide options, this medication or that medication. They may advise on tests, but the patient has the right to make the choice by looking at the benefits and the risks of those medications. That's patient-centered care, and we need to educate patients to be able to say, I don't agree with that treatment. And that's hard to do, but that's the way it has to be done.
So if the patient shows up and tell the doctor that I don't agree with you, and let's say the doctor gets angry or maybe has a certain, communication, it's hard to come back for the appointment, and it's hard to come back, and then where do you start? And I think we just all have to communicate about this. And that's why we have in this conversation and this platform that for all audience, we would like really advise that don't be afraid. You are your own advocate. You are your own advocate. So having support, from us, and, we are physicians with Dr. Drossman. So we really would like encourage, talk to your doctor and just open that conversation. We don't want to create that barrier. We found out that latest studies show that a lot of patients basically hiding information from physician because they don't want to upset the doctor, or they don't want to tell that they taking something that the doctor will agree, and then create a barrier.
Or the doctor doesn't want to hear it. They feel they're too busy. They don't want to hear it. So it's that communication. Now, there are 2 points to be made. One is you need to find doctors. You can look at health grades that patients like. If other patients like the doctor, it's more likely that doctor's listening to you, and they take a little bit more time if they need to. The other thing is there are some tips. You don't have to say, I don't agree with you, doctor. You could say, I'm not sure I'm interested in doing that. Do you have any other options? Get them in a dialogue where they're engaging with you rather than making it a confrontation. It's more judo than karate.
Mm-hmm. Correct. That's excellent point. Well, unfortunately, Dr. Drossman, we are almost approaching our time, and I enjoy so much having you on our show, and I hope you can come back and share more wisdom and also a lot of important tools. And I encourage audience, please connect with Dr. Doug Drossman, and you will learn a lot about gut feeling and a gut-brain barrier. Thank you, Dr. Drossman. Before we sort of pause for right now, I shall pause because I hope I will talk to you soon and we'll connect. Can you tell us what's your last sort of word of wisdom or strategy or something that you want to tell to our audience?
You need to be a partner with your doctor. You don't need to look at this doctor as somewhere up there who's telling you what to do. It's a negotiation when you're talking about chronic symptoms. And also, I think that these GI disorders are real. Even though the studies are negative, they're really happening to you. It's not psychiatric.
Thank you. Thank you very much, Dr. Drossman. And for all audience, this is the Dr. Connect show, and we are discussing experiences and providing information and education around wellness, health, cancer, and medical technology. I'm your host, Dr. Ludmila Schaefer. Thank you very much for being with us on the Dr. Connect show. Please join and subscribe our YouTube channel and comment so you can be also featured on our show. We are super excited to have you on this journey with us. And thank you for watching and listening. And we are looking forward to seeing you soon. And with that, we'll see you soon. I'm Dr. Ludmila Schaefer, and I level the playing field of knowledge around wellness, medicine, and research to help you to make informed decisions.